This month, there's been an emphasis on the need for organ donors, and although Organ Donor Awareness Month may be coming to an end, the need certainly doesn't.
Yeah, and there's a Fresno woman who wants the public to know there is a special need for living donors for liver patients, because for patients like her, their life truly depends on the kindness of a stranger. Luann Cruz will tell you she likes the simple things in life. Family is the most important thing to her, and she just loves being a nana.
I just thoroughly enjoy having the grandkids around. I love watching them grow, seeing their little personalities develop. I love the little things that come out of their mouth and all the things they say.
Time spent with her daughter Jamie, her grandchildren, and sister Vicky, well, those are special times.
Any day that I can go to the movies with my girlfriends or go out to lunch or play with the grandkids or have dinner out with my husband, those are good days.
The bad days for Luann, experiencing the side effects of liver disease.
She's been sick since I was probably about 14, and so I've always really seen her in pain.
The 58-year-old grandmother has primary sclerosing cholangitis, an autoimmune disorder that is destroying her liver. Over the years, the disease has taken a visible toll on her health and could take her life.
I don't want to lose my sister. She's my best friend, and she's a very strong force in our family.
For this family, there is a sense of urgency. Luann's disease has affected the bile ducts of the liver, putting her at high risk of contracting liver bile duct cancer. Because of her high-risk status, Luann's doctors have urged her to seek a living donor.
Our rush is to get a liver before Luann gets bile duct cancer, because once she gets bile duct cancer, they won't do a transplant.
Trying to find someone willing to donate part of their liver has become a family affair. They've built a Facebook page and reached out to friends, and while people have offered, there has been no right match.
It can get kind of overwhelming at times, dealing with it, trying to figure out new ways to contact people. It's not something I can just go on Craigslist and ask for.
Dr. Jennifer Hubbard, a trauma critical care surgeon with UCSF Fresno, says patients seeking an organ from a live donor face a moral dilemma as well. Hubbard says it's difficult for doctors to ask a perfectly healthy person to put themselves at risk.
One of the problems that doctors have to face is taking a perfectly healthy person and doing harm to them. So it is a little bit harder for a lot of people to do that operation and say to a patient, we're putting your life at risk for somebody else's life.
Despite the risk, doctors say the liver is such a large organ that most people can live with only part of it. And it is unique in that it can regenerate or regrow itself. According to the UCSF Living Donor Program, during transplant surgery, about half of the liver is removed from the donor. The organ begins to regenerate itself almost immediately, and within 8 weeks, both the donors' and recipients' livers are almost completely regenerated. The thousands of people needing a new liver believe this information could encourage more people to be a donor.
I, of course, personally want my sister to get a new liver. I want to see her well. But on that quest also is to bring to light that this is a journey that others are going on. And the kindness and the generosity of a stranger can save a life.
And about all the others that this has actually affected. Each year, more than 1,700 liver transplant patients waiting for a live donor pass away. So if you'd like more information, you can go to Luann's special Facebook page, A Courageous Journey. You can learn more there. It's a fantastic story, and we wish her the best, obviously.
We sure do. We sure do.